Dr. Madeline Wilson here, done with residency and out into the real world. I now live in Valentine, Nebraska, which is almost to South Dakota. I first got introduced to Valentine in medical school when I did my rural rotation out here for 2 months. At that time, I fell in love with the community and decided that that was ultimately what I wanted to do and where I wanted to be. The doctor that I worked with actually lives right down the street. Valentine is a beautiful place to live. It's a great place to practice medicine because I can practice full scope, and it gives me the space I need to create the life that I want. Join me today as we go to Cherry County Hospital and Clinic to see what it's like to practice family medicine in rural Nebraska. Here we are at Cherry County Hospital. My typical morning begins with me getting to the hospital and rounding on any inpatients that we might have. Our inpatients range from pneumonia to small bowel obstructions to anything in between. Sometimes we have post-operative orthopedic patients, and sometimes we even have obstetric patients. During my first week of practice, I got to do my first primary C-section, which was pretty exciting, delivered a baby girl. It may seem a little overwhelming to have to do a primary C-section your first week of practice, but the residency program definitely prepared me for that. I want to give a special shout out to Dr. Kenny and Dr. Byers, but also Dr. Janacek, who really helped me with my surgical skills. During many of the rotations, I was able to develop professional relationships with many of the attendings. Some of those physicians I made relationships with actually come out and practice at the specialty clinic we have here. It's critical to have those relationships so that I can provide the best patient care even out here in the Sandhills. I did a lot of rounding on inpatients during residency, which definitely helped prepare me for my daily life here at Cherry County Hospital. The faculty at LMEP were instrumental not only in helping me develop my medical knowledge base, but also in helping me become the physician that I am today.
Good morning, I'm Rick Poppy. You might remember me from a day in the life of a resident video. Fast forward 2 years and here I am at Merrick Medical Center, where I started my first job as a rural family medicine physician. Coming out of residency, knowing I wanted to go into rural family medicine, we had a lot of different options. Ultimately, we chose Merrick Medical Center because of the wonderful people here and the opportunity to practice full scope family medicine. The new facilities don't hurt either. How about you follow me in and I'll tell you more about my day. After walking in and saying hi to my coworkers, I head to my desk to answer any urgent tasks that need done. Once those are taken care of, I head over to the hospital to round on hospital patients. I get to see infants all the way up to elderly with various concerns. After rounding in the hospital, I head back over to the clinic. Clinic has a wide variety of patients, from child checks and infants to farmers coming in with acute problems to chronic care of blood pressure, hypertension, diabetes. One of the great things about coming from Lincoln here to Central City is we use a lot of the same specialists that we had in Lincoln. These specialists are ones I got to work with side by side during Lincoln Family Medicine residency training. And now a lot of them I already have their phone number and I can ask them when I have the questions that come up. And believe me, they do.
So we just finished up rounds. Time to head over to the clinic, gonna meet with my team and then start seeing patients for the day. At the clinic, I get to build long-term relationships with my patients. Many of these people are my neighbors, which really strengthens the aspect of community here in Valentine. But the best part of the clinic is the team I get to work with. Some of them, Annie, Cricket, and Kim, were here when I was a medical student. We enjoy working together and it makes the day better. Small town life really is at its best here in the clinic. We get so many homemade desserts, jams, and fresh vegetables. Not to mention the homemade brownies and chicken noodle soup April brought in last week. It sounds like a Hallmark movie, but it really is real life.
One of the biggest changes coming from residency to the real world is the consistency of schedule. Through medical school and residency, you always have a new rotation you're doing, a new schedule, and here I know exactly when I'm on call, I know when I'm in the clinic, and I know the days I have off too, which has really been great for family life. One of the best things about getting to work here is the brand new facilities I walked into. They just opened this building in June of 2022 and has a hospital, ORs, ER, and a brand new clinic.
All right, well, I hope you enjoyed spending the day with me. I just finished up my clinic. Time for me to head home, hang out with my husband, and play some fetch with my dogs.
Once Laura and I knew that we wanted to settle our family in a small town, we were able to hone in on a few great communities here in Nebraska. But we really liked Central City. The size of the town was really ideal for us. It combined large town feel with small town relationships. You get to form these wonderful relationships and see people at work and around town, and they all know you, and hopefully soon enough I'll know all of them as well. Good luck to all of you as you try to decide the best place for you for residency. For me, Lincoln Family Medicine gave me the best education to prepare me for rural family physician life. I hope this gave you a little bit of a glimpse into my life here in Central City. I'm going to go ahead and grab my kids and we'll try to get some supper. I am on call tonight, but hopefully I'll be able to help put them to bed. See if we can peel them away from the playground.